we've worked together long enough. You know better than to trust me with the technology. I guess we're ready to get started. First of all, let me thank everybody for coming and apologize for the short notice. Biology and epidemiology is sometimes interesting. It doesn't necessarily follow the schedule that we think it otherwise should. My name is Todd Bell. I'm the local health authority for Potter Randall County. I'm trying to fill the big shoes that Dr. Scott Milton left when he stepped down last month to take a different position. I also am an associate professor in the Department of Pediatrics at Texas Tech University Health Science Center. Today we're not surprisingly, we're going to be talking about COVID. In our community, we've actually seen an unprecedented rise in the number of COVID cases. Yesterday we had more than 300 cases. That was the highest number that we've had over the past year since 2021 started. We also see that the rate of rise is something that we haven't seen locally throughout this pandemic. Our numbers are increasing. A lot of that seems to be due to the Delta variant of the COVID virus. The Delta variant, as you guys have read through the news and understand, is not the same as the original virus that we were seeing before. It's much more transmissible, more than twice as transmissible as the original COVID variant. It's an equal opportunity infector. It affects the young, the old, the sick, the healthy. Everybody is at risk. When we look at the original COVID variant, that seemed to be mainly a problem of the elderly, those who are medically vulnerable. Now we see that we're all potentially at risk of this new virus as it's come on board. I was actually a little bit late coming to the press conference this morning because I was taking care of a junior high age kid who's excited about starting back into school. She's now been hospitalized for a second time. Today, I believe, was day 10 of her hospitalization, and because of complications of COVID. Last week, I was in the hospital covering the adult service. I actually had to transfer 4 patients from the floor to the intensive care unit. The oldest of those 4 was 52. Everyone else was younger than that. Again, this is not the same as what the COVID was that we were seeing a few months ago. The Delta is different. At its most fundamental, public health is public. This is something that we don't have a government agency that's going to step in to get rid of this virus for us. We don't have any technology that's going to crop up that is going to suddenly appear on the horizon that's going to be able to change the tide of this surge of COVID. It's going to be a public issue. We all have to be a part of this. Knowing that we're all at risk, all of us have family at risk, all of us have neighbors at risk, we all need to be part of the solution to being able to take care of this COVID surge. What is that solution? Is things that you guys have already been told multiple times. You know this. We got to get vaccinated. If you're not vaccinated and you want a vaccine, we can get it for you today. We have vaccine that we're going to have to be throwing away soon because it's going to have reached its expiration date. If you're not vaccinated, you have to get vaccinated now. If you're not wearing a mask, you need to wear a mask. The Delta variant is evolving and mutating. It's changing. We're having some breakthrough infections, even in folks who have been previously infected with the prior virus and in folks who have been vaccinated. We know that the vaccine's not 100%, but we do know that it's the safest and best tool that we have. But if I'm on a battlefield, even if I have a bulletproof vest that blocks 8 or 9 out of every 10 bullets that gets fired at me, I'm still also going to wear a helmet and I'm going to dive into a trench. I need to wear a mask in addition to being vaccinated right now in our community because we have viral bullets that are being fired at us all the time. We need to practice social distancing. We need to get back to that, keeping the 6 foot of space. Nobody likes that. I want to be able to go to church and hug on folks. But right now is not the time to do that. Right now is not the time to be giving the virus an opportunity to spread. We need to practice good hand hygiene. The things your grandma told you about washing your hands when you leave the bathroom, after you pick your nose or touch your face, those are all things that are still going to be important. The point is that the only way that this public health crisis comes to any sort of good conclusion is if the public itself is part of the solution to this. We have several folks that would like to be able to speak to you today. We have some representatives of the hospital, physicians, and staff at the hospitals. We have our public health director who's going to speak to us. And at this point, I'd like to turn it over to them. My understanding is that we'll take some questions at the end. Next, we actually have Dr. Brian Weiss from Northwest Hospital.
Well, good morning. Every week when we do this press conference, Dave asks me, Dr. Weiss, how are you doing today? So I'm going to give him an answer. I'm scared. I'm very scared. Hey, we have heard the term unprecedented used throughout this pandemic ad nauseum. Well, I'm going to add to that because I've been in medicine for over 33 years, and I've never seen our resources strained like this in the medical field. This is truly unprecedented. Hey, I'm hearing doctors nationally talk about healthcare system failure. I've never heard that in the United States, but we're hearing it now. What does that look like? Well, I'm worried it looks like what Northwest looks like right now. This morning, we started with 20 patients holding in our emergency room. That is 20 patients who are sitting in our ED waiting for a bed to come available. The longest one has been there for 53 hours. Over 2 days, this person's been waiting for a bed. Hey, since the beginning of this month, we have not started a day with less than 15 holds, and we've had upwards of 35 holds in our emergency room every day. We asked the question, why are you having to hold patients in the emergency room? A couple of reasons. First is staffing, and that's the most important. They're saying right now there are 23,000 open RN positions in the state of Texas. Where do those nurses go? Well, I can tell you where ours went. Hey, during the pandemic, ours left to travel. Hey, a lot of them retired because they had enough. We had a lot of young RNs come in that realized very quickly they were not fit for this. They did not have enough experience to deal with this. So we lost a significant number of our staff over the last year and a half. Okay? And what has that resulted in? That has resulted in having to close entire units. Okay? We closed an ICU. We closed a med-surg floor because we can't staff it. Okay? That's why we have patients holding the emergency room. Okay? But the second thing is this COVID surge. Middle of summer, we were down to a single-digit number of COVID patients. We started August 1st with 26 patients with COVID in our hospital. We have almost doubled that in now 11 days. We're up to almost 50 patients. Okay? That is 50 beds that are now necessary for COVID patients that are not available for people having heart attacks or strokes or coming in with traumatic injuries. That's why patients are holding in the emergency room. Okay? My big worry is now pediatrics. As Dr. Bell mentioned, this virus, the face has changed. We have now several 20-year-olds in our hospital, several 30-year-olds in our hospital that are in our ICU suffering from COVID. The saddest thing is trying to figure out how to help their young children come in to visit their mom or dad and stay safe from this virus. And we deal with that every day, is trying to let families come in and see these young parents. Right? So that's the thing. So we know that we've lost all these staff, we're closing units, and now we're looking at kids getting infected. A year ago, maybe we'd have one child with COVID. Now we have 5 or 6 at all times in the hospital with COVID-19. We have a 12-bed pediatric ICU. Because of staffing, we have 4 beds available in that ICU right now that we can staff safely. There are now 4 kids in that ICU. That's it. That unit right now is tapped out. Now we're a week away from school starting, or less than a week away, and we have no pediatric capacity right now. This is very concerning. For those of you who are parents, have had a child with asthma or caught croup, you've seen what a panicked child looks like who can't breathe. That's what COVID-19 does to kids. These kids come in, they can't breathe. It is horrible to watch these kids suffer and be so anxiety-ridden with that virus. So that's where we are today. The other thing to keep in mind is what we do in this area affects the entire region. We have all these hospitals out in the region that, because of one reason or not, they ask the hospitals like BSA or Northwest or VA to take patients because we're a higher level of care. And we're glad to accept those patients. Today, there are 43 patients out in the region waiting for beds to come to Amarillo because we can't take them. 43. 23 of those are patients that need an ICU bed. We can't take them. 17 of those patients are patients who have COVID that need an ICU bed. We can't take them. So everything we do in this community is affecting the entire region here. Right? So what do we need to do? Well, Dr. Bell did a great job of saying we know what we need to do for COVID. I'm going to add to that. Okay? We're a trauma center at Northwest. Okay? Please don't get on your motorcycles. Don't ride your ATVs. Get the kids off the trampoline. Okay? Because if you come to Northwest with an injury, I cannot guarantee you that we can give you the care you need because of our limited capacity. Okay? For every bed that's consumed by a COVID patient, that's one less bed we have for people with heart attacks or strokes or other pneumonias or other sicknesses. This is the problem we're in right now. So what I ask is we need to all keep ourselves safe. Safe from COVID, but safe, period. Because right now our hospitals just don't have the capacity to take care of anyone in an expedited way. Thank you.
Good morning. I'm Dr. Lamentier. I'm the Chief Medical Officer at BSA Health System. You guys all know me from our prior year and a half of dealing with the COVID pandemic. Dr. Weiss and I have become good friends over the past year and a half, sharing some of the same stories, some of the same frustrations with what's going on with this pandemic in our community. Dr. Bell has graciously stepped into the position of Director of the Public Health Department. Dr. Milton did a yeoman's job for us this past year and a half. I'm going to start off today with talking about a couple things that are really making me nervous, that are making me anxious, and that are making me highly frustrated. And I hope you can hear me clearly, and I'll be happy to answer questions at the end of this with the rest of this panel. Number one, I want to dispel a couple myths at the beginning of this press conference before I get into anything else. What's a common myth that you think I've heard? Not just from people coming in the hospital, but some of my own relatives, friends, family members. Myth number one, COVID's not real. It's just like the flu. Wake up, get a clue. It is not like the flu. It is 10 times more lethal than the flu. It is becoming more rampant in our community. It is devastating our healthcare system. You have to get your facts straight. You have to make sure you understand what's going on before you start making assumptions that are incorrect. Myth number two, all the people in the hospital today are those that are vaccinated. Wrong. That is false. The majority of people in our facilities that are hospitalized are those that did not get vaccinated. Myth number three, the vaccine's 100% effective. That is incorrect. It's not 100% effective. No therapy we give for any medical condition in the history of the world is 100% effective. So remember that. But when we tell you that something's 95% effective, that's extremely successful. Our success with the flu vaccine historically has been in the 60-70% range, and the flu vaccine saves thousands and thousands of lives every year. The vaccines that we have available today are extremely effective. Delaying your decision to get vaccinated is putting you at risk of death, is putting your family members at risk of death, and it's irregardless of whether you have health problems today or not. Yes, you're higher risk if you have health problems, but you're at risk even if you do not. We could name patients in our hospitals today that have very minimal health concerns and are in our hospital on a ventilator struggling for their lives. I was looking at charts last night in preparation for this conference, and to protect patient privacy, I obviously can't go into details of those patients, but I'm frightened by what I'm seeing. As of Monday of this week, 89% of the people we had in hospital beds because of COVID are less than 60 years old. And of those, only 4 were vaccinated. That was 48 was the number that were less than 60. Only 4 were vaccinated. Do the math. This is not complicated. This is not rocket science. Today, we're up to 63 patients in the hospital. 63 COVID patients hospitalized. Of those, 28 are in our intensive care unit. Half of those in our intensive care unit today are less than age 60. That is not old, folks. That is not old. Do you know how many people we admit on an annual basis that are in their 90s that come into our hospital that are functional 90-year-olds, functional 80-year-olds, doing things daily that they enjoy? They have minimal health problems, or some have chronic health problems. they're not making up the majority of our patients right now with COVID in the hospital. It's the younger patients that are coming in that either refuse to get vaccinated, or maybe they were one of the unfortunate ones that got vaccinated, the minority, but had other health problems that prevented them from having a good level of immune response, or have other drugs that they must take for other health conditions that decrease the effectiveness of the vaccine. It doesn't mean the vaccine doesn't work. That is illogical to think that that would be the assumption for someone who's in one of our beds that's been vaccinated. Overall, since we've seen this surge come back, and again, 63 patients, as Dr. Weiss said, we were single digits in June. We had 6 patients in the hospital, 5, 6 a day. We felt pretty good about where we are. We don't feel good about where we are right now. We are frightened. As I walked into our hospital again this morning and I started talking with our nursing leaders, we're talking about how we had to shut down our intermediate nursing care unit this past week. That is a step-down ICU level. But if you remember, last year when we said we had 94 ICU patients at BSA, 94, that was because we were using units that we historically had never used as an intensive care. We had to convert one of our cath labs to an intensive care. We had to use a holding area as an intensive care. How many of you want to come to the hospital with a need for intensive care services and you're in a suboptimal unit? You're in a unit that we don't normally take care of you in. It's a holding area. We have the potential to get back there if we're not doing the right things immediately, which is getting vaccinated, taking personal responsibility for wearing a mask, social distancing, good hand hygiene, all those decisions that are important to protect you and your family. I can't tell you how many times we have stories coming back from our physicians that are managing these patients every day at BSA that are telling me that the families and the patients are saying, we thought this was a joke, we thought this wasn't real, and their loved ones in the ICU on a ventilator. And some of the young patients that are on ventilators, and you may not know this, but if you're on the ventilator too long, we have to do a procedure on you where we have to cut a hole in your neck and we have to put the tube through your neck into your trachea so we can not allow breakdown of the trachea, which comes through the tube down the mouth. It's a horrible situation. Horrible. Patients can't talk. They're in pain. They're short of breath. The historical presentation for COVID, and what we hear patients say is, I can take pain, doc, but I can't take not being able to breathe. The sensation of not being able to breathe is one of the worst sensations that you could have as a patient. And that's when we're putting oxygen on you and we're putting it in at high flow and we're trying to do things for you to make you feel more comfortable. When you can't breathe, it is an awful sensation, and that's what this virus does to you when you start to deteriorate. We have some drug therapies that are slightly effective, that are helping to prevent some hospitalizations, but nowhere near as effective as the vaccine. Prevention is the best thing for COVID-19 when it comes to keeping you and your family safe. And when you're thinking about personal decisions about what to do for you and your family, think about what your family would do if one of the primary caregivers was no longer there, was in the hospital, if mom was gone, if dad was gone, if your child was gone, and gone potentially because they're in the hospital admitted for weeks, or God forbid, gone because they succumbed to the disease and they died. We need to do things now to help protect our families. We need to do things now to protect our healthcare infrastructure so that we can manage people that have all the other health problems that we have to deal with on a daily basis. You heard Dr. Weiss say, please don't get on a motorcycle, don't have a trauma, don't have a heart attack, because we're going to be at a point where we can't manage you. We don't have the capacity right now at BSA to have 94 ICU patients. Why? We don't have the nursing staff. For the reasons that you heard that I won't reiterate, we don't have the nursing staff to take care of that number of patients. We're asking for additional resources in a very vigorous way. We're putting out lots of contracting offers to get more staff. It's not yielding the results that we need to manage the current patient burden that we have in Amarillo. Overall, our percent of patients that are hospitalized that are unvaccinated, if you're looking for those numbers, it's 82% of all people we have in the hospital that are unvaccinated with COVID-19. That's a small percentage of the remaining that are vaccinated and hospitalized, and I went through the reasons about that. I think it's also important to talk about, in addition to the things that Dr. Weiss said, the people that come into our hospital and that need to be admitted, and we have to tell them they have to wait in our ER to see if we get a bed to open up to bring you upstairs. That is not a good situation for anyone. That's not something we like to do. We're very concerned about providing the best patient care experience with the best level of quality, and we can't do that when our resources are overrun because we have too many patients coming in with this virus. We are not far, in my opinion, from a situation that's happening with some of our partners in East Texas, where we have some of our health systems within the Ardent Health system. They are getting overrun with COVID there. Their testing rates are 50% of all their tests are coming back positive. If you ask me what ours is, right now it's 20% of all of our tests are coming back positive that we do at BSA. 1 in 5 patients. But that number has gone up from being very small in the 5 to 6% range back in June to now 20%. It has not been that high since last December. Last December, we were at 17% of all tests. Remember how December felt. We're getting back to the same level of concern that we were in before, and it has the potential to be worse because the virus is mutating, it's more contagious, it's more lethal, and yes, we're having breakthrough infections, which means that people that are vaccinated are still at risk of getting infected. The good news is, if you're vaccinated and you get infected, the chance of you having a severe infection is far less. We're up to 40 employees now that are also quarantined at BSA. We had 0 employees quarantined a couple months ago. About a third of the employees that we have quarantined have been vaccinated. Fortunately, none of them have been requiring any kind of hospitalization. And I think that touts the efficacy of the vaccine. I've talked to some of these individuals. They're very thankful they got vaccinated. They're very thankful they made what they felt was a very critical decision, and their prognosis could have been far worse if they didn't do the right thing. And they were hesitant, many of them, about getting vaccinated early. They said, I wasn't sure about it. I wasn't sure about the studies, but I decided it was probably the best thing to do. Thank God, Dr. Lamentier, that I got vaccinated because I felt horrible. I didn't need to go in the hospital, but I couldn't breathe. And I can't imagine what it would have been like if I didn't have some protection. These are the stories that we're getting. I want to wrap up now because I'm taking up too much time here, but I wanted to make sure that our message was emphatic. We are very concerned. Our staff will not put down their stethoscopes. They will not put down anything that they need to do to make sure that they're taking care of you. They're working tireless hours, but we can only ask people to work so many hours. Nurses can't work 30 days a month. Doctors can't work 30 days a month. We're not getting the additional staff. Please do what you can do to help us protect you and protect our community. Thank you.
Good morning, everybody. My name is Dr. Catherine Ewing. I'm the nurse exec and the Associate Director of Patient Care Services at the Oklahoma VA Healthcare System. I come to you today to also resonate many of the stories from our community partners that we are also experiencing. The Delta variant has greatly changed the trajectory of how it's impacting our community. We too are seeing patients of a younger generational age. We too are seeing people very sick, and those that come in very sick too have yet to be vaccinated. I can't stress enough to our veteran population that we have vaccinations for you. And through the Care Saves Life Act, I also have vaccinations for your caregivers. So please, you can walk into the VA healthcare system and get vaccinated. We too have had the struggles that occur in the community hospitals. This week on Monday, we expanded our beds in our intensive care unit. Within 20 hours, we were already on divert because those beds were full with people who needed critical care. Not simple illnesses, but very sick individuals. So I really stress to the community that though we're here for a community partner, this is becoming an overwhelming, challenging situation. The VA has a little bit of a unique situation, and as being a partner and a portion of the largest healthcare system in the nation, I do have the ability to pull from our Department of Emergency Personnel Services. So yes, sometimes I can get help, but this is not a unique situation to Amarillo. If you watch TV, you know this is occurring across the nation. So I can't stress enough. And you know, the biggest heartache I can share is I just want to share a story. There are nurses across the United States that are challenged. We have been talking of a nursing shortage significantly in the last short while. I can't stress enough, though, that this has not been an emergency of a month or weeks. We've been doing this for a year and a half, and as previously shared, there comes a point in time of exhaustion and physical and psychological components. And I can tell you one of the hardest challenges that is being felt amongst healthcare professionals is when I can't even allow somebody, because their loved one is so very sick, to touch them, to kiss them goodbye. So COVID is not a nice thing. It is a very real thing that's impacting communities across the campus, and Amarillo is currently being impacted. So please know, if you're a veteran out there, that you can come to your Amarillo VA healthcare system. We certainly are trying our best to also contribute to our community support. I understand as of yesterday, there is the initial steps in progress of a STAR request, which would allow us to begin our Fourth Mission Act. That will allow us to then open up to community partners. And I can tell you that for the first round of the surge that occurred the end of last year, we were able to help out quite a few of our very rural community hospitals who are holding patients in need of care. So we look forward to doing anything we can to support this, but certainly I resonate to all of the conversation prior to me. Please get vaccinated, wear your mask, and do your part as a partner in this community. Thank you very much.
So, my name is Casey Stoughton. I'm the Director of Public Health for the City of Amarillo. Our team has been together for about 18 months now, and you've heard us go through highs, you've heard us go through lows. This is certainly a low here in our community right now. Our doctors are begging us to do the right thing and to make it easier, to free up beds and to help them in caring for us. At this point, I can't imagine that there are very few of us that haven't been touched by COVID-19. Over the past weekend, one of my very best friends had to make end-of-life decisions for her own mother, withdrawing life support for her mom and making those tough decisions due to complications of COVID. A colleague lost her husband to COVID. He left behind school-age children. So this school year, their kids are going to start school without their dad. And as a mom, I can't imagine how hard that's going to be. You know, she and I talked about what it would take to get people's attention, and she said that she didn't even have a full grasp of the situation until she was sitting next to her husband while he was dying. She was watching other people who were dying in the hospital alone, and that's probably one of our biggest fears, is to die alone, and that is happening in our hospitals today. And so she and I talked about kind of what it would take, and she encouraged me to share her message and to share her story, just so that perhaps one family doesn't have to go through the situation that they did. This family's in their 40s, which really probably, it feels like it's, hits very close to home in our house and probably in many houses in our community. So we have heard the stories today, heard our physicians talking, heard our hospitals sharing their situations, and so obviously we have met the metrics to move to level red. It's critical that you know that our hospitals are at critical capacity. We're here because there is no plan C. We have moved, we've gone to plan A, and we've moved to plan B, and there is no plan C right now. And so we're asking you to do your part. We'll remain in level red for the next couple of weeks, reevaluating the data, but we've got to alleviate pressure on our hospitals because they are our resource for healthcare here in the Panhandle, in Potter Randall County, the Panhandle, and they're out of space. That is not something that we consider even feasible in the United States and in the Texas Panhandle, but they're out of space. And so we've got to do our part in alleviating those beds. Wearing a mask today, putting your mask on today, will slow the spread of transmission and will free up beds in our hospitals. Getting a vaccine today will slow the surge and will free up beds in our hospitals in weeks to come. So as we have entered into the darkest days of this pandemic, I just want to thank our physicians, thank our hospitals, thank our health authority for the hard work that they're doing, and encourage our community to do their part. Our team is happy to answer any questions that you might have, so thank you.
Tyler Williams with KGNC News. We hear from some local businesses that the governor says I don't have to wear a mask, so I'm not going to wear a mask. Why is it still so important I know you just answered it, but why is it still so important that people still wear masks? So,
we shouldn't have to have a mandate to do the right thing. And right now, the right thing to do is to put a mask on. We've heard from our hospitals that they need help, that their hospital beds are full. If you have a car wreck today, there may not be a bed. You may stay in the emergency room for over 50 hours. And so even though there's a mandate that says that you don't have to put a mask on, the right thing to do is to put a mask on. And so that's what we would encourage our community to do.
David Gay, Amarillo Globe News. With school, starting next week, and a bunch of the doctors talked about the dire straits when it came to the pediatric situation here. Is there any, extra worries? I know with school starting and with kids, gathering in rooms together, trying to get as back to normal for the school year as possible.
Absolutely. We were just looking at a chart earlier, and it showed how a spike will increase if there's no masking, if there's partial masking, and then if there's full masking. And so we certainly expect an increase in cases if there's no masking in our schools. And so again, there's not a mandate for that, but we know what the right thing to do is. And so absolutely, we're very concerned about that. It's something that we need to be prepared for. And Dr. Bell, I'll turn it over to him.
I'm so sorry. Well, let me just put on my pediatrician hat for just a second, if that's all right. So we all understand that there's not a government mandate to wear a mask. However, we also understand that we have an obligation for personal responsibility. That includes both us and our children. Now, there's not anybody who's going to be walking around behind your kids seeing if they're wearing a mask. But if you look at the number of contacts that the average child has during a school day, it's about 50 close contacts per day. You look at the average number of contacts that an adult has in a typical day, it's about 9. When we look at the number of infections on average that one Delta infection results in, so if I have Delta and I'm wandering around through my usual day, on average I'm going to infect 6 other people over the course of my illness. Now, I'm an adult, and I don't have near as many contacts as what the kids are when they're in the school. So I totally get that there's not going to be a mask mandate. There's not going to be any mask police. What there is, though, is an obligation to us as citizens in this community to be called to a nobler purpose than self-gratification or grandstanding. We need to do what's right for the kids. So far this week, every time that I have a patient with a respiratory illness being admitted to the pediatric floor, I have to call our ICU doc, our pediatric ICU doc, and discuss with them whether we're going to have a bed for that child to go into if the child were to worsen. These aren't the kids that are needing the ICU initially. These are kids that I think I can take care of on the floor, but because of those bed shortages and nursing shortages, we have issues. Not all those kids are COVID, obviously. We have kids that are being admitted for other reasons as well. All those usual things that occur over the course of a year, those things are still happening, and we got to figure out a way to be able to protect our capacity to take care of those things in addition to taking care of the COVID. Sorry, I was just on a roll on that. What else we got?
Sorry, I took the mic. Sorry, David. I'm Allie with KAMR Local 4
Hi,
News. So we've heard a lot of other local governments throughout Texas as we're talking about the governor's no mask mandate coming back. What are the discussions that any of you have heard about those kind of discussions here?
Yeah, so there's a lot of talk, a lot of discussion. That's something that I can't affect, right? I can't call up anybody at any level of government, short of our local government, who are very responsive, and I appreciate the opportunity to work with the team here. But there's not something that we can do that's going to automatically institute a mask mandate, and that's why we're really reaching out and wanting the public at large to be able to do the right thing for them and theirs, so that we can protect our community. And I'll actually turn it over to Madam Mayor.
I'm very grateful to these doctors and to all of our medical community, and they're asking for our help. So this is not a question of politically how do we feel about it, or do we think the governor's making the right choice, or, you know, my response is all of us should pray for the governor. He's in a really hard place, and there are no easy decisions here. Texas is a big state, and it's difficult for one person to make a decision that's the right choice for the entire state of Texas. But I'm listening to what our local doctors and our local medical professionals and experts are asking us to do locally. Our effort, our energy is best spent listening to our local doctors and putting all our efforts behind what they're asking us to do. So that's what you're going to see us do. Our local government is going to partner with our local medical community and educate and ask our local citizens to do what we can do as quickly as we possibly can to change the situation of our hospitals. Delta is different, and we need to be talking about that, answering questions, making sure that everyone in our community, not just Amarillo, because we know we live in a panhandle community, and that's a 5-state region. Everyone needs to understand Delta is different, and we're going to partner with our local doctors and do everything they've asked us to do to help our community. Thank you.
And then my next question is, just from what we've heard about the shortages and then the long hours and the months without being able to go on break, really, when there's no one to come in to help, how are hospitals or anyone who can answer this, how are we able to, just help the stress levels of the doctors and nurses? What help is there for whether that's on our part or the hospital?
I'm going to ask one of our hospital colleagues, if you would. They can draw straws.
Allie, thank you for that question. That's a very important question. I'll tell you what, a lot of our staff that are here now were the ones that got us through the previous surges. They are beat down. We are struggling with morale right now. Okay, it's on a daily basis that I see nurses in our ICU or on our COVID floor that say, I can't do this again. We're trying to support them. We've got things we've started in terms of special teams that try to help them spiritually and emotionally and psychologically. But, it's one of those things. I mean, every day I hear someone go, I can't believe this is happening again. I just can't do it. And that's our biggest fear is literally watching nursing staff leave the profession. Just, they've had enough. So we're very concerned about that and struggling with how we can better support them.
Speaking as a physician myself, I think one of the most demoralizing things from a physician standpoint is when we go out in the community and after busting our heinies all day in the hospital or our nurses busting theirs, to go out and see folks who aren't doing the right thing. Again, it's a free country, I get that. But I think if people are looking for something to be able to help support the physicians and the nurses, the first thing is do the right thing. Get vaccinated, get your mask on, wash your hands, do the social distancing. And I think that fact that can create a light at the end of this tunnel is going to be probably something that helps support the morale, maybe more than anything else we can do. The signs, the baking cookies, I'm not against cookies at all. But the reality is what we really want is people to do the right thing so that this COVID problem doesn't just continue perpetuating.
David Gay, Amarillo Globe News once again. I know that we talked a lot about vaccinations today, and I can't remember, forgive me, which doctor spoke about this, but talking about, potentially throwing away vaccines after their expiration date. Can, I guess...
that was me.
Oh, okay. Can someone talk a little bit about how many vaccines are we talking here? And how many... Because I know that it just it was so there were so many who got it at the beginning and then it's just fallen off. So are all the hospitals, is the public health department dealing with that as well, having to throw away vaccinations just because of lack of demand?
So I can't give you any exact numbers. What I will say is this is a national issue that we've seen. There was something in the national news just recently about the state of Mississippi and the number of vaccines that they had thrown away across the state. Again, our issue is that we've kind of hit this brick wall where folks have decided that either they don't want to get the vaccine because they don't like how it was developed, or they don't want to get the vaccine because they think COVID's kind of over-exaggerated, or they don't want to get the vaccine because they think Bill Gates is going to be tracking them around. Again, we see just these fallacious arguments. They don't want to get the vaccine because they think it's going to be increasing the risk of getting COVID. That's like saying that I'm not going to use an umbrella because I think I'll get more wet with an umbrella than without it. Well, if you use an umbrella right, chances are you're going to get less wet than you would if you didn't have an umbrella. Realizing West Texas winds, sometimes that's not true. But we get some breakthrough wetting with umbrellas in West Texas. We're going to get some breakthrough infections with the vaccines. But at the end of the day, it's the best protection that we have. What we do know is that these vaccines are fragile. They're something that they don't last very long. That's both a good thing when we look at those side effects that we get from the vaccine, the sore arm, that low-grade fever. Those are short-lived things because this type of vaccine just doesn't stick around in the system very long. Unfortunately, that also means that there's a shelf life that we can keep these things in the freezer. Once it hits the shelf life, then we no longer have good data to say that it's still effective, and we got to throw them away. So all across the country, we've seen that our community, our nation has made all these vaccines, and we've given them, and we so appreciate those folks who've been vaccinated. But we see that we've hit this wall where we just have more vaccine available than we have people that are willing to pick it up or willing to go to the trouble of getting the vaccine so far.
Hi, Francis Casado with NewsChannel 10. We're seeing vaccine mandates gain momentum. Are the hospitals considering to implement mandatory vaccines for workers?
I'm going to turn that over.
That's a great question, and I think that the short answer to your question is that is absolutely an eventuality of what's going to happen, is that we're going to have vaccine mandates for all healthcare workers across the entire country. There are a number of factors that I think make that decision to move to vaccine mandates a little bit more complicated, especially when we're under the EUA right now for the vaccine. We're hoping that is going to be changing very soon, which means that we have full FDA approval, which means that the studies that have looked at the vaccines through those scientists working for the FDA, also getting input from the CDC, are saying that has the track record been long enough where we're going to say there's FDA approval. We're highly confident that is in our immediate future as far as the FDA approval. I think that's one small piece to where we're headed with mandatory vaccination for all healthcare workers. I think it's a personal responsibility For individuals that have no reason why they can't get vaccinated, that's a good reason, meaning an allergic reaction, which is a potential, very uncommon, but a potential. But if there's not that reason, there's a personal responsibility to get vaccinated if you're a healthcare worker. We're trying to encourage this. We're getting increasing numbers of employees vaccinated at our facility. We're very happy about that. We understand some of the fear. We understand some of the apprehension. But now is not the time to delay. We've got to get vaccinated. We want to protect our staff.
Another question. You guys already mentioned, the shortage of nurses, but is cost also influencing the ability to get the personnel at the hospitals?
That's a very good question. Cost is always an issue when it comes to supply demand of a resource, and the human resource is our most precious resource in the healthcare facilities. Trained individuals that know how to take care of people when they're sick, nurses, respiratory therapists, all other kinds of therapists, physicians, obviously. Those are all highly trained individuals that take time to develop. We can't create a nurse in a day. We can't create a doctor in a day. And because of that precious resource and the ability of those individuals to work in many places and the shortage that we have nationally, we're all in the same predicament. We are putting extensive resources financially out to attempt to get contract nursing, and we're getting very little yield. And again, it's because of the shortage. We're not unique. It's happening all across our state. Nurses are in great demand, and we're putting out lots of dollars to get them, and we're not getting what we need despite that.
And with the governor announcing, the 2,500 additional nurses, are we receiving any of those?
We hope to. We have not been given any definitive timeline. We have put in requests, which we've been instructed to do, regarding how many nursing staff we need, how many other staff, like respiratory staff, we need. We've submitted those requests, which is the process to do that. And now we have to wait for the state to determine what the allocation needs to be, so that they're giving enough staff to all of the places in Texas that need staff. And there's certainly other places that need staff beyond Amarillo.
And my last question will be for Casey. We're moving to level red. What does that change?
So our recommendations are much stronger. So, again, practicing strict social distancing. We're always wearing a mask in public settings, especially indoors. Enhanced hygiene and cleaning, avoiding social gatherings, avoiding non-essential travel, and avoiding non-essential interactions. So really just making sure that we reduce the burden on our community and reduce the burden on our hospitals. So there's a lot of personal responsibility in these. And so, just like Dr. Bell said, we all want to go to church and hug on people, but maybe, when you go to church, put your mask on and, fist bump. All of just minor changes to our daily interactions and our tweaking some of the things that we do can make such a huge difference in our hospital capacity. So that's the crux of what we're trying to do is to really just make a big impact with small changes that we can all make. Correct. Yeah.
Alrighty, and then I had one last question. So, speaking about capacity, before last year, towards the end of the year, we were having to use the tents. Is there any talks of those having to come back? And then on top of that, our morgue trucks, between the hospital tents and the morgue trucks, are those talks coming into play again because of our capacity issues?
I'll take a swing at that because that kind of becomes a community issue. The one good thing that we've seen so far is that our death rate from Delta is not as high as it was from the original virus. Now, the reason for that is not that Delta is somehow more contagious but less deadly. It's that those folks who were at greatest risk of dying were actually smart enough to get vaccinated. So our vaccination rate amongst our elderly and the vulnerable is significantly higher than our vaccination rate in the population at large, in the general population, and certainly in our population under the age of 50. So because of that, that effect of the vaccines, our death rate is not as high as it was. So we certainly hope that we never get to a point that we need to be thinking about morgue trucks and things like that. Regarding the tents, there are things we're specifically looking at to try to be able to do preventive care. There's now some data on using a certain type of, or a certain monoclonal antibody product. If you remember back last year, there was a lot of talk with big names of medicines that we all had trouble pronouncing. Those same monoclonal antibodies or similar ones actually may have some benefit in patients who have just been exposed to the virus and are at risk of developing complications. It may be something that we can utilize. It's still in that pre-hospitalization phase to try to prevent hospitalization. And so we're looking at those, and we're actually have been talking about those even this week, setting those things up. However, you're looking at treating a lot of folks to be able to prevent a few, with a lot of resources, to be able to prevent a few hospitalizations. The single most cost-effective thing that we can do is to get people vaccinated, to get people to wear their mask. Masks are cheap, and they work. And if we can get people to do those things, then that's going to be a whale of a lot more bang for our buck than it is of setting up additional sites where we're doing those monoclonal antibody infusions. We're looking at all options, but we want to go back to the fundamentals. It's like your coach said in basketball, you got to have the fundamentals down first. And that's what we're really just encouraging people to do.
Just to remind you, though, so a lot of times in the previous surge, we talked about using tents as kind of spillover facilities. Both Dr. Lamantier and I talked about we have whole wards in our hospitals that are empty. Hey, we have beds, we have rooms, we just can't staff them. So right now, there's really no need to have spillover facilities because the same problem comes up. We can't staff them. So that's the biggest challenge. But right now, we have physical space, just don't have the staff for it. So.
Any further questions? All right, thank you for being here.
Yeah, he called me the other day and